So chapter 35, geriatric emergencies. So I like old people. They're usually my favorite kind of patients to deal with because your older population of folks, usually when they call you, they need you, and they're super thankful and appreciative of your time and that you're there. So a lot of times they're a lot of fun to just listen to. The stories they'll get to telling you and the things. Every once in a while you get that crabby old lady or crabby old man that you're just like, oh great, here we go again. But for the most part, I enjoy the elderly population. I enjoy interacting with them. They can be a hoot. I tell you, I've had more old folks in the back of my truck that are hysterical than any other group of patients that use a There we go. All right, so we consider a patient to be geriatric at the age of 65 or older, okay? So I will tell you though that in today's time, with underlying medical conditions, poor health, poor nutrition, just poor lifestyles, you're starting to see these geriatric traits in people younger and younger. So you might run somebody that's 55 years old that looks like they're 85, and due to their underlying medical conditions and body systems, things like that, you may have to treat them more like that geriatric population. Do an assessment more like you would on a geriatric patient. Use some of the assessment tools that you'll learn about. So, yes, that's the number that we say, yep, you're geriatric at 65. But that can flex a bit depending on lifestyle and underlying conditions, okay? All right, so they can present as a special challenge to healthcare providers. Usually one of the biggest challenges that you run into is communication. They can't hear well, they can't see well, things like that. It's typically one of the biggest challenges that I run into. They're frail. Lots of fall down, go boom type calls in this population. Okay. All right, so it's important to understand and appreciate how the life of an older person might differ from yours. Like I said, these folks, they've lived through different eras. They have different life experiences. A lot of folks, you run those folks that lived through the Great Depression. It's always interesting to go into their homes and the things that they keep and hold on to, and the stories they start to tell you. So it's just a whole different experience dealing with these people. A lot of these folks are terrified to have to leave their home. So, they fall down and, you got this little 90-year-old woman that has been independent all her life, lives at home by herself with her cat. She trips and falls and breaks her hip. And you get there and she's not really, she's like, yeah, my hip hurts, but I don't want to leave, because what are they worried about? They're worried about leaving their cat, and they're worried they're not going to come back home because they hear all the horror stories of their neighbor, their neighbor friend going into the nursing home after she fell and broke her hip. And so they're ultimately just terrified. You'll get the little lady that breaks down and just crying, and please don't take me, your hip is broke, you can't stand up. But they don't, well, can you feed my cat? Absolutely. Can you get my purse? Absolutely. Okay, so a lot of times it just takes being empathetic. It takes communicating with them well. It takes helping them get the things that they need, making them feel a little more comfortable, because they may not come back home, or they may go to the hospital and have to have surgery, and then they go to a rehab facility for months, maybe months before they make it back home. So contacting family for them, getting a contact number so that you can call, let somebody know you're taking them to the hospital. Will you call somebody to come feed my cat? Absolutely. I'll do all these things, help you out here. Okay. It takes time and patience to interact with an older person, treat the patient with respect, and make every attempt to avoid ageism. So what do I mean by ageism?
Stereotypes that people like
calling them son, dear, or thinking that they can't hear you, that all old people can't hear. So you go into it yelling at them right off the bat, and they're like, I'm not deaf. Like I've seen, like new paramedics or paramedic students that come ride. I'm like, okay, well, you're the team lead, get on in there. And it's always kind of fun to, maybe a little cruel, whenever I've ran this patient multiple times. This is the first time the medic student's running home, and I'm like, get on in there, do your thing. And they walk in the door yelling at them, and I'm like, this is gonna be fun. You watch this, hold my beer. Yeah, this little old lady's like, I don't need you to yell at me. I can hear just fine. And then, yeah, it's always a little bit, but that's how you learn, right? So one of the things that I've had to be mindful of is I grew up in the South. And so everything is ma'am, dear, all those in terms of endearment in the South, okay? So, I grew up with everything with yes ma'am, no ma'am, yes sir, no sir, like that's like, to this day, if I go home, my mom's like, what did you say? Oh, yeah, sorry, my bad. So people here in the Midwest do not like being called sir and ma'am. They get offended by it. They'll get pissed off at you. Like, don't call me that. Call you what? Sir. Oh, like, I thought I slipped up and called you an asshole or something. Like, what just happened? People will get angry with you for using terms of respect. And you're not meaning it disrespectfully. You're meaning it more of a term of endearment, or, like I said, trying to be respectful, and they get offended by it. So things that you just have to be mindful of, that some folks don't appreciate your endearment, okay? All right, so communication techniques. So speak respectfully, identify yourself. I know a lot of older folks want to know what your name is. They always ask you, what's your name? I have a granddaughter named Ashley. That's wonderful. But they always want to know what your name is, okay? So identify yourself, get down on their level. If there's, that's one thing I always hate is that when you're dealing with pediatric patients or you're dealing with geriatric patients, folks always want to hover over the patient. Well, it's uncomfortable. I don't want someone hovering over me. So if you have this little lady that's on the floor or sitting in a recliner or a little old man, you need to get down on their level. Especially if they're hearing impaired, a lot of them learn to read lips and look at facial expressions and things like that. They need to be able to see you. So get down on their level where they can look you in the eye. Be aware of how you present yourself. Look at them at the eye level. Speak slowly and distinctly. Okay, that doesn't mean that you slow down like Forrest Gump, but you may have, if they're hard of hearing, and you identify that, you may have to slow down for them to read your lips, okay? So judge the situation. Don't just assume they're all hearing impaired and reading lips, but if you find that that's the case you're dealing with, you may need to slow down a bit for them to understand you. All right, so, depending on the circumstances, with your question, there's been times where I've had folks that are so hearing impaired that, you try everything you can to communicate and see, like, I have hearing aids, but you get on their hearing aids and still can't hear you. So I'm like, well, I'm just gonna get a piece of paper and a pen at this point and start writing it down. And I hold it up and they're like, oh yeah. Okay, next question, okay? Yeah, it takes more time, it takes more effort, but if that's what works, then that's what works, okay? Give the patient time to respond. And that's one thing, especially in younger generation, we don't listen to wait for a response. We listen to immediately answer something. So slowing down and giving folks time to give us the answer, especially older folks, sometimes they have to think about it for a minute. Or you may have that patient that's got dementia that can typically answer their questions, but it takes 1 minute. So give folks time, explain what you will do before you do it. So it's just like with little kids, I'm gonna put this blood pressure cuff on your arm. And little old people don't like blood pressure cuffs. It's killing me. You're cutting my arm off. I've had little ladies yelling at me. I'm not, okay, and you just can't, reason with them, but make sure that you explain to them. I'm gonna start an IV. Putting a tourniquet on a little thin, frail old lady's arm is painful, so remember things like putting it on over clothing. Even blood pressure cuffs, a lot of time I'll put it on over their clothing. There's nothing wrong with putting a blood pressure cuff over clothing as long as it's not bulky. So just being mindful of those simple things. The older you get, your skin becomes thin, you don't have as much fat and adipose tissue. So yeah, it's very uncomfortable. Sometimes, it's like, well, I have to do these things. But how can I go about doing it that's going to make it more comfortable for them? Okay. All right, so some of the things that they're predisposed to. So hip fractures are common. one of the most common orthopedic injuries that we see in our geriatric population. So especially in elderly females, it's very prominent. So anytime, we always say, fall down, go boom. That's like just that's the thing we say. But especially in elderly females, that's one of the first things that we're going to assess for typically. As long as they're awake and alert and breathing, we're going to assess their hip. Okay. So osteoporosis, so bones become frail and fragile and wear down over time. Especially women that have had multiple children, their calcium stores have been depleted. So these little women, it doesn't take anything. And I've had a little lady step off of the front porch of her house, literally step one step down onto the ground, and her hip just completely shattered. So things to be mindful of. These folks become very frail at points. Sedentary behavior can lead to pneumonia and blood clots. Okay, so a lot of times it's not anything necessarily underlying medical conditions, but say their social group starts to pass away. So all the folks that they've known for years start to pass away and they're the only one left. So all they do is sit at home and watch Days of Our Lives and pet the cat. So they just become very sedentary because they lose their social group. They may lose their spouse. Their children may pass away. I ran lots of folks that they're like, well, my husband died, my children have died, all my friends have died. Here I am. Like, why am I still kicking it? So they lose that social group that they're used to, and they just become very sedentary. So pneumonia is one of the leading causes of death in the elderly population. So something to be mindful of. These folks, and they will sit at home for forever and then decide to call you when they're septic and extremely ill. Okay. All right, so here's a table from your book that you can review with some of the common conditions and leading causes of death. All right, so some physiological changes. So all tissues in the body undergo aging. Okay, getting old sucks for most people. Okay, decrease in the functional capacity of various organ systems is normal, but you have to keep these things in mind. Like over time, the heart starts to wear out. The heart muscles aren't as strong. So you start to see conditions like seeing death in the elderly population. Their lungs lose their elasticity. The alveoli start to break down, so gas exchange is poor. So you get patients with a combination of COPD and CHF, and that just becomes a nightmare for them. Vasculature starts to wear down and break down. Blood clots in the lower extremities. Their skin becomes thin. They're not able to keep themselves warm anymore. So you go into a little lady's house and it's July and she's got the heat on and it's 100 degrees in there and she's got an African covering her up and you're like, good God. That's like that happens. They can't keep themselves warm anymore. Okay. All right, so airway becomes weaker. Okay, so all those structures become weak or stenosed. I ran a cardiac arrest a while back. It was an elderly gentleman, he's in his 80s, real tall, thin guy, had a hollow neck, and I was like, oh, this is gonna be easy too. And so got in there, could see the vocal cords, and I just pulled a standard size ET tube out of the bag. And I went to try to pass the tube, and it was like just hitting a brick wall. And I'm like, I'm tapping on his vocal cord at the end of the tube, and I can't get the tube to pass. So, I looked at the EMT, I'm like, so my supervisor was there, and he's like, what's the problem? I said, his vocal cords are like a brick. Like, I cannot get the tube to pass through the cords. So they handed me a smaller diameter tube. I was able to pass it, but he had vocal cord stenosis. I mean, it literally, like, I was tapping on I'm like, I don't, what is happening here? But they wouldn't budge. So you start to see anomalies and things like that with the aging process. Something I had never encountered before. And now I know, if I run into that again, I just need to grab a smaller tube and it'll be fine. Got him intubated, but it caught me off guard. Okay. So the alveoli and the lung tissue become enlarged and the elasticity decreases. So what does our alveoli control and manage and handle for us? gas exchange, okay? So these patients aren't able, that oxygen, carbon dioxide exchange isn't happening like it should. So some of these older folks, you put them on end-tidal, and their end-tidal readings are all over the place. Not because necessarily you need to fix anything, but just because of the aging process. They don't exchange gases the right way. Body's chemoreceptors slow down. So what are our chemoreceptors in our body control for us?
pH level,
pH level. Okay.
CO2.
Okay. Those they, of course. Your chemoreceptors deal with thermoregulation. Yes, no. Yeah. Okay. So, as in one of our main chemoreceptors is in our parotid bodies, right? In our necks. So these your arteries and your veins start to stenose over time. So that's where you start to have issues with your chemoreceptors. All right, so pneumonia. Again, so this is one of the leading causes of death in Americans over the age of 65. So the issue here is these folks become septic. And bye, folks.